Okay class, in this video we're going to be demonstrating assessing blood pressures on our patients. So just to be safe, we are always going to do our necessary steps when entering a room, right? Like providing privacy, making sure that we are introducing ourselves, hand hygiene, proper PPE, verifying the client identification, verifying if they have any allergies, and then providing the education on what we're doing, right? Like our general survey. But once we're done with that, we can get started with our actual blood pressure demonstration. So the first thing we're going to do, we're going to look at the patient. We're going to make sure we pick the right arm that we're going to use for our blood pressure. We're going to make sure that the patient is sitting. Miss Jones is going to be my patient for the day. So Miss Jones is sitting for me in this demonstration. I've made sure that we use her right arm. And the next thing I'm going to do is assess her brachial artery. I need to visualize it because I need to use this for my blood pressure. Once I've done that, I need to choose the appropriate cuff size. Each patient will be a little bit different, but for Miss Jones, we'll be using this adult size cuff. For thinner patients, you will be using a smaller cuff. For bigger patients, you'll be using a bigger one, but this one is appropriate for Miss Jones. Next, I'm going to find her radial pulse. On your paper, it does say brachial, but we'll allow you to use the radial as well. We're doing this to find her estimated systolic pressure. So now that I have found her radial, which is right there, I can go ahead and apply the cuff to my patient. You'll notice on your cuff, there is a little arrow, if I could find it. This arrow right here, this needs to be aligned with the patient's brachial artery, which is why we visualized it earlier. So I'm going to find the brachial, which I did earlier. It needs to be at least 1 centimeter above or 2 finger lengths, or 1 inch, I believe, sorry. We're going to apply the cuff, making sure that no clothes are touching. Go above by 1 inch. Sorry, Miss Jones. Then I'm going to tuck this in right here so the patients can see. And now the next thing we're going to do is look at our aneroid manometer, which is just a fancy word for this right here. And we're going to make sure that the needle is aligned with the 0. Now that we've done that, I'm going to close the air pump. I'm going to find that radial pulse again. All right, and then we're gonna pump this up until we cannot feel her radial artery, okay? So if you notice the manometer is going up, I can still feel her radial pulse. And right there, I cannot feel it anymore. So that will be her estimated systolic pressure. Now we can deflate to let the patient rest for a second. Now, while we were deflating and while I got rid of that radial pulse or I stopped checking, I need to give the patient at least 1 minute to rest. And in that 1 minute, I'm going to clean off my stethoscope, but I cannot move far away from this manometer. I need to stay at least within 3 feet. So while that 1 minute is going up, I'm going to clean off the earpieces. That'll be going in my ear. Another one, and I will clean off the diaphragm of my stethoscope, which is the bigger part. And then on the other side, I will use this to clean the bell. So now I've checked my watch. It has been a full minute since we have deflated the cuff. I will go ahead and apply the stethoscope to my ears. I am tapping this to make sure that this is on the diaphragm because it can turn and now it's on the bell, but I'm going to switch it back to the diaphragm. I will place the diaphragm on my patient's brachial artery. And I need to make sure that it is not touching the cuff. I will close the air pump once again. And now I will be inflating the manometer all the way above 30 millimeters per mercury above the estimated pressure. So her estimated was 120. I'm going to be going to 150 and no higher. And now I can slowly let the manometer go down. And I'm listening for that first lub, which I just heard. I'm listening until that lub stops, which it just stopped right there. So now I can deflate the patient's cuff. So the first lub was at 126. And the lub stopped at 82. So now the systolic pressure will be 126. The diastolic will be 82. Now that I have done that, I can go ahead and remove my cuff off the patient. Sorry. I can make sure that the patient is comfortable. Ms. Jones, are you comfortable?
Yes.
Do you have any questions about your blood pressure?
No.
Alrighty, now that I have made sure the patient is comfortable and I've covered her back up, I can clean the bell and the diaphragm of the stethoscope with an alcohol pad, and then I can store it, and then I can ensure that the client is in a safe position, which Ms. Jones is, and I will compare the findings with the client's baseline. If we notice that there is an abnormal blood pressure, we need to call the doctor and find out what the next step is. But otherwise, that is the end of the demonstration. See you guys in the next one.